Hello everyone, I'm Dr. Anita. Today we have Dr. Anila Patibandla, clinical oncologist at American Oncology Institute. Let's learn about breast cancer from her today. Good afternoon, ma'am. Recently we are hearing a lot about breast cancer. How common is breast cancer and in what age group it is most common this year?
Hello everyone. Hello Dr. Nandita. Breast cancer is the most commonest cancer in Indian women. If you look at the statistics, every 4 minutes, one woman is diagnosed with breast cancer, and every 30 minutes, one woman dies of breast cancer. So it is quite common. And if you look at the age group in the clinic, we see patients above 40 coming with breast cancer, and it peaks at 50 to 60. Having said that, we do occasionally see a woman in their 30s, and I've seen a few in their 20s with breast cancer.
What are the common risk factors of breast cancer?
Dense breasts, and if they have any benign breast lumps before, previous radiotherapy to the breast, if they have a long estrogen exposure, early menarche, late menopause, late childbearing age, and some lifestyle risk factors like obesity, alcohol, and smoking. These are all the risk factors, and 10 to 15% are familial breast cancer. So if the person carries BRCA1 or 2 mutation, they are at high risk of breast cancer.
What are the most common signs and symptoms of breast cancer, ma'am?
So women usually present with the breast lump. Either they have felt that breast lump, or sometimes they've gone for some investigation and it's found to have a breast lump. Any nipple discharge, serous or bloody nipple discharge, changes on the skin of the breast, redness, teething, any lumps in the armpit, neck. These are all the symptoms which patients present breast cancer present. And if the breast cancer is advanced, then they might present with weight loss and loss of appetite.
Is there any way for early detection of breast cancer by themselves when the patient?
So there are few things which women have to do to protect themselves from breast cancer and get it diagnosed earlier. So we advise all girls are after 20 years of age to do self-breast examination every month. And a woman over 40 years to get mammogram every year. So mammogram is simple X-ray of the breast. So this is an excellent screening test, and we are able to detect tiny lumps as well a couple of years before they are palpable clinically.
Can you explain more about self-breast examination?
So self-breast examination should be done by all girls from 20 years of age. It should be done every month after their menstrual periods. So the girl or woman has to stand before the mirror, raise their hands above the shoulders and look at the breast and see for any changes in the breast, any engorgement of veins or any change in the skin, redness or teething, puckering of the nipple or indrawing of the nipple, any lumps and bumps visible. Then they have to put their hands on their waist and look at both the breasts again to see whether there are any changes. Then they have to lie down, and if they are palpating their left breast to start with, they have to do with their right. And if this is the center of the breast, and start with the nipple and go around with the pads of the fingers, go around the whole breast and examine and feel for any lumps or any changes in the breast. Then they have to go and examine the armpit. So both breast examination and both armpits, and see for any discharge from the nipple as well. So if they get if they get it done, they are used to do it regularly, then they can pick up any changes in the breast very early on.
What is the general approach to presence of breast lump?
So if they present with the breast lump, first we do the clinical examination to feel for the lump, any lumps in the armpit or neck. Then we send for a mammogram, and usually on the mammogram they comment whether the breast lump is looking benign or malignant. If it's looking malignant, suspicious, then we ask for a fine needle aspiration using simple test, which takes out of the cells from the lump and look under the microscope. Or if it's highly suspicious, then we go for a core biopsy, good chunk of the tumor, to examine whether it's malignancy or not. If it is confirmed malignancy, then we go for further scans to stage the disease. Either we can go for a CT chest abdominal bone scan or a PET scan. And then further investigations will follow.
Once she is diagnosed with breast cancer, what is the treatment approach to cover? And tell about the recent advances of breast cancer treatment.
So once a patient diagnosed with breast cancer, once we have staged them thoroughly, then on the core biopsy sample we get the ER/PR heartbeat status, which it tells us what type, whether treatment is, whether the cancer is hormone responses to hormone treatment or chemotherapy or targeted therapy. So for an individual patient, the type of treatment depends upon what stage, their age, their comorbidities, and what their receptor status is. So no two individuals will have the same treatment. And so if they present with early stage 1 or 2, they go for surgery upfront, followed by chemo or radiotherapy depending upon the post-op histopathology. So in HER2 positive or triple negative, in stage 2 as well, we might go upfront with chemo, depending upon the patient. But if it's stage 3 or stage 4, we go for chemo first to downstage the tumor, then go for surgery. So the bottom line is, the earlier the patient is diagnosed, earlier stage 1 or 2, less the duration of treatment is less, the number of modalities is less financial toxicity and treatment toxicity, and better responses. Whereas if they are diagnosed with stage 3 or stage 4, then the treatment length is longer, lot of financial and treatment toxicity, and the response rates are less, prognosis poor. So it's very important women follow 2 simple rules of self-breast examination and mammogram screening.
Is there any genetic predisposition to breast cancer?
10 to 15% of breast cancers are familial, so some families carry BRCA1, BRCA2 mutations, and these individuals are at high risk of breast cancer.
Before we wrap up, please, would you like to give any general advice to all the women regarding breast cancer?
So from 20 years onwards, make a habit to do self-breast examination. It's a simple, non-costly, no cost involved examination, which will help you, and make it a habit, get mammogram regularly after 40 years of age. So awareness is important. So if you find any symptoms, any lump in the breast or any symptoms, then take professional advice, see your doctor, either going to see a physician. Don't attempt to self-diagnose. Treatment, breast cancer treatment has advanced a lot. So the response rates, progress is excellent in stage 1, stage 2, and still in stage 3, stage we can do a lot. And the breast cancer treatment is changing day by day. So we have to keep fear away, look after ourselves and present early, and get the right treatment done.
Thank you so much, Dawn, for explaining about breast cancer. Thanks for watching our NP Live session. If there are any queries, you can comment down below in the chat box. And for more information about other cancers, please subscribe to our Oncology Institute channel.